Public health departments across the country have been putting in lots of overtime since the pandemic began. Much of it unpaid. That includes those right here in central Illinois. But they say they know it's part of keeping the public safe. WCIA 3's Courtney Bunting is live in the newsroom. Courtney, it's not only difficult, but a lot of the work that they've been doing has been thankless.
It really has, Paul, and with some pushback. And as we know, that work continues. And for some of them, has even picked up with the vaccine clinics that are starting. On top of that, many of their jobs are now much different from what they were originally hired for, all to accommodate the needs of the public.
It's expected that public health will step up during an emergency, but that's not necessarily for an entire year.
But that's what happened. Health department employees rose to the occasion to keep the community safe and informed throughout the pandemic. Awais Vade with the Champaign-Urbana Public Health District says that extra work has inevitably meant longer hours.
All of our administration team have been answering emails, phone calls on evenings, weekends, early mornings. And all those hours don't get counted.
The work, I mean, it really never stops. You could go 24/7 if they let you.
Whitney Greger is the assistant operation lead for CUPHD.
For the last year, I mean, I've been working over that 40-hour week, whether it's, staying in the office longer or answering emails longer or answering text messages longer.
But she recognizes that all public health employees are going through the same thing. So it also applies to Vermilion County Public Health.
We are very much aware of the fact that sometimes someone will walk in the office and say, I just need the rest of the afternoon off. Okay.
Administrator Doug Toole says his role means even one day off is rare.
I'm putting in a lot of hours, except for a few major holidays. There tends to be like a day or so per month I'm not here.
But while those demands can be exhausting, it's the reward of what they do that keeps them going.
A life saved is like saving mankind.
On top of overtime, a lot of health department roles have changed. For example, even dental hygienists are now doing contact tracing, or environmental specialists have taken on COVID-related tasks as well. It's definitely all hands on deck. Live in the newsroom, Courtney Bunting, WCIA 3, your local news leader.
No question about all hands on deck. Courtney, thanks.